Hello everyone. Today we are going to learn about psychiatric nursing skills. What are the skills which is important to be a psychiatric nurse? So we will be learning today about psychiatric nursing skills. Let's start. So mental health nursing is the practice of promoting mental health as well as caring for people who have mental illness. Potentiating their independency and restoring their dignity. In order to fulfill this arduous occupation, a mental health nurse must possess a sound knowledge base and the requisite skills for good nursing practice, which means for being a mental health or psychiatric nurse, someone should have that caring nature in them to take care of mentally ill patients. Then they should maintain their dignity and they should have knowledge about psychiatric nursing. Let's start further. Prerequisites for mental health nurses. What are the skills a mental health nurse should have? So, personal skills, under that adaptability and care, values and attitudes. So, what is adaptability? Before adaptability, we will be discussing about self-awareness. In personal skills, self-awareness is very much important. So it is a key component of psychiatric nursing experience. It is an answer to the question, who am I? The nurse must be able to examine personal feelings, actions and reactions as a provider of care. A firm understanding and acceptance by the nurse allows acknowledging a patient's differences and uniqueness. She should have self-awareness, like who I am, why I am doing my job. She should have that feeling of action and reaction when she is providing the care. Next is adaptability. A mental health nurse needs to be adaptable to different settings and cultures. A nurse is working with all the cultures people. She is not only taking care for urban people or rural people, or she is not only taking care of rich or poor. She has to adapt all the cultures to treat all kinds of patients. Working within residential settings, for example, may demand attitude and role which are different from working in the community. When you are working at home settings, it will be different from community settings, right? So your adaptability according to the environment or according to the in which environment you are working. As in residential settings, the nurse may have an authoritative or supervisory role, which she necessarily does not have in community. So a mental health nurse also needs to cope with a variety of social and cultural settings. Social settings involve the class and the status of individuals, while cultural settings involve race, ethnicity, and gender. Therefore, she may need to be familiar with the issue that arise in cross-culture mental health nursing. So this was about how a nurse should adapt a culture, a different religion, different settings of working. Then next is care and values. So what are the things included in care and values? So self-awareness, self-esteem, respecting the person's right, listening, then responding with care and respect, supporting with trust and confidence. Then reassuring with explanation and honesty. Whatever you are explaining or whether you are reassuring the patient or patient family, you should be honest to them. And physically nursing, the helpless with the compassion, carrying out procedures skillfully, and the last one is working within personal and ethical boundaries. So this was about personal skills. So in personal skills, you should have self-awareness, adaptability, and care values and attitudes. Then we will be talking about counseling skills. So what is counseling? In this, a counseling it means a professional person is helping an individual to solve his or her problem setting. So that is counseling, first of all. Now, what are the skills in counseling? So, unconditional positive regards, non-judgmental approach, empathy, warmth and genuineness, confidentiality is must, non-verbal sensitivity, non-verbal attending, non-verbal responding. And other interpersonal skills required are paraphrasing, reflecting, clarifying and summarizing. Next one is behavioral skills. So these are based on Pavilion principles and Skinner's principles, and it includes to increase adaptive behavior. In that, first one is positive reinforcement, second one is negative reinforcement, and third one is token economy. This all we have seen before. Next is to decrease maladaptive behavior, extinction, timeout, restraining, and overcorrection. Third one, to teach a new behavior, modeling, shaping, training, and cueing. So this is about behavioral skill, how you change a patient or a client's behavior according to whether you need to increase adaptive behavior or you need to decrease maladaptive behavior or you need to teach new behavior to the patient. Next one will be supervisory skills. So supervision is an integral necessity for any worker in the caring profession to ensure the best quality service for client and best quality developmental opportunities for workers. A good supervisor requires interpersonal and professional skills, technical knowledge, leadership qualities, and human skills. So these are the skills which you need to have when you are supervising. So this is all about supervisory skills. Next one is crisis skills. So aggressive and assaultive behavior of violent patient, self-harm, acute alcohol intoxication are some of the cases a nurse is likely to encounter in the course of her practice. So in such situations may cause the nurse to feel overwhelmed with feelings of helplessness, powerlessness, and inadequacy. Exercise of self-control, calm, rational thinking, and identifying way of obtaining help from the other people are some of the skills to be cultivated by psychiatric nurse when confronted with such crisis situation. It means whenever nurses feel that they are in crisis situation, like example we have seen like aggressive behavior, or if you see assaultive behavior with violent patients, self-harm or acute alcoholic intoxication patients, they will be abusing. So in that situation, what you need to do, you will feel helplessness, you will feel that you don't have any power, inadequacy. So in that condition, you need to have self-control, you need to have your calmness, you need to have rational thinking that what other way you can adapt to manage the situation. So these are about crisis skills. Next one is teaching skills. The relatedness to the nurse's ability to explain, enabling full understanding on the part of the client. It also involves enhancing the client's environment in order to maximize his awareness of the things around him. It is necessary for the nurse to be enthusiastic about activity and choice of the clients, and also give the client every opportunity to use his power of judgment in order to make decisions. Whenever patient asks anything, so a nurse should have that ability that she can explain whatever patient is asking or whatever patient's query is that, and she should make a patient understand in a patient's understanding level. She should not use the professional wording, or she should make him or her understand at what level he or she is able to understand. Standards of mental health nursing. So there are a few standards of mental health nursing we will be going to see. Professional practice standards is there in that, and professional performance standards. So this practice and performance standards. So we are going to see one by one. So the purpose of standards of psychiatric and mental health nursing practice is to fulfill the profession's obligation to provide a means of improving the quality care. By this set of standards, the main purpose is to improve quality of care which we give to the patient. So the standard presented here are a revision of standards enunciated by the Division of Psychiatric and Mental Health Nursing Practice in 1973. So first one is Standard 1, theory. The nurse applies appropriate theory that is scientifically sound as a basis for decisions regarding nursing practice. Psychiatric and mental health nursing is characterized by the application of relevant theories to explain phenomena of concern to nurses and to provide a basis for intervention. There are theory which we use in psychiatry. Pavlov theory is there. Then we use the next one is Standard 2, data collection. So what happens in data collection is so what we were talking about this theory. In theory, like we can use Orem's theory, which is also called behavior nursing theory, which focuses on self-care, efficiency, and this theory is used in psychiatric nursing. Then what other things we use? Pavlov theory. Then moral development theory is there. Then we use Roy's adaptation model. Pavlov theory deals with interpersonal relations. So these are the theories which we use in mental health nursing to make the interventions. Next one is data collection. So the nurse continuously collects the data that are comprehensive, accurate, and systematic. Effective interviewing, behavioral observation, physical and mental health assessment enables the nurse to reach sound conclusion and plan appropriate interventions with the client. It means if you have proper data collection about particular person. It will be helping you to reach a conclusion or to plan an appropriate intervention for the person. Next one is standard 3, diagnosis. So the nurse utilize nursing diagnosis and or standard classification of mental disorder to express conclusion supported by recorded assessment data and current scientific premises. Nursing's logical basis for providing care rests on the recognition and identification of those acute or potential health problems that are within the scope of nursing practice. So what is a diagnosis? Diagnosis is, as a nurse, what you diagnose in a person, what problems you find out in a patient. So that is diagnosis. Standard 3, planning. Standard 4, planning. The nurse develops a nursing care plan with specific goals and interventions, delineating nursing actions unique to each client's needs. The nursing care plan is used to guide therapeutic interventions and effectively achieve the desired outcome. Next one is intervention. So the nurse intervenes as guided by nursing care plan to implement nursing action that promote, maintain or restore physical and mental health, prevent illness and efficient rehabilitation. So under intervention, psychotherapeutic intervention will be there. So what is psychotherapeutic intervention? We will be seeing. So psychotherapeutic intervention, in that nurse use psychotherapeutic intervention to assist client in regaining or improving their previous coping ability and to prevent further disability. Then health teaching. What is health teaching? So in that, a nurse assists the client, family and groups to achieve satisfying and productive patterns of living through health and teaching. Next one is activities of daily living. So in that, what nurse do? Nurse use the activities of daily living in a goal-directed way to foster adequate self-care and physical and mental well-being of the client. Then somatic therapies. What is somatic therapies? So in that, a nurse uses knowledge of somatic therapies and applies related clinical skills in working with the client. So somatic therapy is one of the example is ECT, electroconvulsive therapy. Then therapeutic environment. So the nurse provides structures and maintains a therapeutic environment in collaboration with the client and other healthcare providers. Then psychotherapy. In that, a nurse utilizes advanced clinical expertise in individual, group and family psychotherapy, and that child psychotherapy and other treatment modalities to function as a psychotherapist and recognize professional accountability for nursing practice. So this was about the interventions. Next, we will be seeing evaluation. So what is evaluation? The nurse evaluates the client response to nursing action in order to revise the database, nursing diagnosis and nursing care plan. So we have seen planning. First, we have seen theories. What are the theories we can use in mental health nursing? So based on that, using nursing theory, we will be collecting data. After collecting the data, we will be formulating the diagnosis. According to the diagnosis, we will be planning what can be done for the patient. Then we will be doing interventions. What are the interventions we can use to treat the patient? Then at last, we will be evaluating that what are the intervention we have used, whether that is appropriate or not, patient's condition is improving or not. So this is about evaluation. Next, we will be seeing professional performance standards. In that, first is peer review. So what is peer review? Peer review is just 2 minutes. Yes, professional performance standards. In that, first one is peer review, then continuing education, then interdisciplinary collaboration, utilization of community health system, right? Research. So what is peer review? The nurse participates in peer review and other names of evaluation to assure quality of nursing care provided by the client or the client. And continuing education, the nurse assumes responsibility for continuing So in peer review, sorry for the delay. So the nurse participates in peer review and other means of evaluating to assure quality of nursing care provided for the client. So in peer review, a nurse is asking to their peer members, to their staff members for the review. Next one is continuing education. The nurse assumes responsibility for continuing education and professional development and contribute to the professional growth of others. Then interdisciplinary collaboration. The nurse collaborates with other healthcare providers in assessing, planning, implementing and evaluating programs and other mental health activities. Without collaboration with other departments, proper planning and implementing the care which she wants to give, it is not possible. Then utilization of community health system. The nurse participates with the other members of the community in assessing, planning, implementing and evaluating mental health services and community systems that include the promotion of the board continuum of primary, secondary and tertiary prevention of mental illness. And the last one is research. So in research, the nurse contributes to nursing and the mental health field through innovation in theory and practice and participates in research. So today we have learned about Here we are concluding our topic, and we have learned today about psychiatric nursing skills. In that, first we have seen prerequisites for mental health nurse. In that, personal skills. In the personal skills, we have seen self-awareness, adaptability, and care values and attitude. Then we have seen counseling skills, then behavioral skills, supervisory skills, crisis skills, and teaching skills. Then we have seen standards of mental health nursing. In that we have seen professional practice standards and professional performance standards. So in professional practice standards, we have seen theory, data collection, diagnosis, planning, and interventions. In interventions, we have seen psychotherapeutic intervention, health teaching, activities of daily living, somatic therapies, therapeutic environment, and psychotherapy. Then we have seen at last validation. Now we have seen professional performance of standards. In that peer review, we have seen continuing education, interdisciplinary collaboration, utilization of community health system, and at last we have seen the research. So this was all about mental health nursing skills or psychiatric nursing skills. Thank you.